Thank you, Lourdes. Good morning to all. So on behalf of my colleagues at Jacobi, I'm here today to present to you the cure violence model that's based out of Jacobi Hospital. And hopefully I don't have the same experience as Howard. So what I see for what I've been hearing is it's been a lot of approaches. What kind of approaches, what type of interventions could be made to prevent the devastation of violence, right? Especially gun violence, as we've been speaking about. And we have definitely noticed the ripple effects that gun violence has on not only the community, but individuals themselves, right, and their families and loved ones. So, a public health model for treating violence is this. Which one is it? That's the one, okay. Thank you. So, the cure violence model recognizes violence as a disease and public health crisis. The model was developed by Dr. Gary Sluckin, who noticed a large areas of gun violence in Chicago were clustered, similar to the ways infectious diseases clusters develop. So as you see here, if you was to place the diagram shown on the left with the shootings over the infectious diseases, in this case is diabetes, it would be a lot of similarities, right? So Albert Bandura, a psychologist, he said, most human behavior is learned through observation and modeling. From the very beginning of the plagues that killed millions hundreds of years ago, society judged those suffering through moral lens. Examples, they were bad people, or they must have done something wrong as God was punishing them. However, modern science and health practices have intervened to dispel this antidote ideas. And much of the developed world now views communicable diseases as a health issue that must be treated. Cure violence, I'm sorry, bear with me. So many published independent external evaluators of the programs in various cities over the years, which have shown significant decrease in gun violence, such as Chicago, Baltimore, and New York City. Cure Violence is now ranked as the top 10 NGO nonprofit in the world by the Global Journal. The health approach is currently deployed in more than 23 U.S. cities and over 50 neighborhoods in 8 countries on 5 continents. As shown, so as you see, this is like something that's global. It's not just within the 5 boroughs or within the states. It's, we even have cure violence out in Puerto Rico. They trying to now expand it to Dominican Republic, Haiti. They taken a real strong approach at creating this model globally. So, as Dr. Slunkin, with his brilliant invention, as treating violence as a contagious disease, you see here there's 3 major components and taking that approach. And one of them is to interrupt the transmission, right? To identify and change the thinking of individuals who are involved, with the lifestyle and or subculture of gangs, and change the community norms. So some may say, how can this possibly be done, right? That would be the question you would probably ask yourself. So the importance of this is that by detecting and interrupting conflict to prevent retaliation, one must identify the highest risk, meaning the highest risk individual who could actually inflict harm upon another person. So violence at work resolve to engage community leaders, residents, business owners, faith leaders to help bring awareness on the devastation of gun violence that it has in the communities and reject violence in the neighborhood. Because as we know, oftentimes individuals become desensitized to, to just seeing gun violence in the neighborhood. So it's almost like you're in the living room watching TV, you hear gunshots, it's like, oh, whatever. That happens here every day. So one of the major things that we try to focus on is trying to desensitize the community by canvassing the neighborhoods regularly. The Every Cure Violence model has a team that consists of, which I explain later on in detail, of design roles that plays a significant role in the community, meaning as, for example, outreach workers, violence interrupters that are 8 hours out in the community, canvassing the neighborhood and engaging the high-risk individuals. So at Jacobi, we have 3 precincts that we're responsible for. So we cover the northern section of the Bronx. I don't know who's familiar with the Bronx here. Anybody show of hands? Anybody from the Bronx? Okay. So we're responsible covering from our zone starts at Pelham Park South, where Jacobi Medical Center is located, all the way to 229th and White Plains Road. So the 3 precincts that we cover, when I say precincts, meaning that those is the target areas that was designed because of the prevalence of gun violence. So it was the 43rd, the 47th, 49th. The 43rd being the newest one, which is responsible for the Bronx River houses, and Stratford, which is predominantly Bloods and Crips. So what's a credible messenger? Anybody want to take a shot? Anybody? It might be some in here in the room. That's right, Loris. What would you consider a credible messenger to be? You got it. You sound, but you got it. Yeah, you're right. Anybody? Good. That's right. That's right. They're all right. You sure you have my sheets? You looked at my notes while I went up for coffee? I think everybody touched on it. Everybody's correct. So a health outreach worker is most effective when a worker who shares the same neighborhood and background as those as the highest risk. Outreach workers already have the trust of those high-risk individuals, therefore are more able to influence and change behavior, right? By modeling positive behavior. So we know that the same impact that someone has amongst their peers when they do wrong, it has the same effect when they do positive. So, and the model believes in hiring individuals from those target areas that have the most significant influence amongst their peers. It doesn't matter what rank they're at as far as gang activities. They'd rather not have someone who's actively involved in gangs, but as we know, that's a challenge in itself for someone to just drop their flag and you know what, I'm calling it quits, because there's severe consequences to that. However, it's also attempting to change the mindset of that individual that's coming on board, because he has to lead by example. So that's one of the I would say the strengths of the program, because a credible messenger will be someone, as everyone said, someone who's already walked down that path. So therefore, they have, they're able to identify, they're able to relate with the high risk individual, opposed to a social worker who's looking at and trying to address the situation from a text perspective. So these are some of the criterias that's required in the cure violence model, as far as for someone to become eligible to become a participant in the program. So they have to be from ages 14 to 25. Obviously, we have individuals on caseloads actively at the moment that's a lot older than that, because I believe that there's really no age that, we have individuals that's a lot older that still behave like adolescents, and they still want to be out there, banging and, causing destruction in the neighborhoods. So we encourage anyone. We really don't turn anyone down. However, our primary concern is to target the youth. The cure violence model also consists of trying to not just meeting the participants where they at, meaning that it's a volunteer thing. It's not like they being coerced to join. It's not mandatory. They're not mandated. So it makes it a lot easier to engage them. They're more receptive when approached in that manner. What else? So the outreach workers, they have a caseload up to 15 participants each, and their role is to more or less, sort of like a social worker would do, screen, assess, and try to create a treatment plan, that's designed to their needs. So if mostly 9 out of 10 times they don't have jobs, they're not enrolled in school, they either dropped out or they even considering trying to get their GD. Some of them have even seeked out help to try to enroll back to college. So they help with that process, with the referral process. So it's amazing how when I meet a youth that's active, when I'm talking about active, he's like one time, I'll give you an example, because the participant, each supervisor has to meet the participant before they enrolled into the database. So we have to develop also a report just as much as the outreach worker, because it comes with because the database is driven anonymous, so there's really no way of really feeling the fidelity of the program. So that's when we come into place, and we sort of have to meet the person to make sure he's a real person, that the outreach worker had put on his caseload, etc. So me myself, I take that very passionately. I love engaging them. So this one individual had one time FaceTime me, right, out of the blue, and I was like, what's he FaceTime me for? He showed me bullets. He showed me bullets. He didn't show me a gun, but he did show me the bullets. And instead of trying to counsel him via phone or try to put him down or anything like that, I shifted it and put the blame on myself. So he was blown away by that, because the first thing I said to him was wow, I failed you. So he was like, what you mean? I failed you. And I was like, we're against that. We're against gun violence, and I'm seeing you showing me that. So automatically he thought I was gonna praise that or commend him for showing me that. But once he seen the opposite, and then I showed him, I kind of sort of discouraged it. A few days later, he comes to me. He was like, yo, Rob. He was like, yo, I'm sorry, man. And I was like, what happened? Wow, you don't have to apologize. He was like, nah, man, I feel like I did let you down, because I know you always trying to steer me in the right direction and this and that. Well, I share that to say that sometimes we take it for granted how much these youths, are really crying out for help. And I think that it's all on the approach that we take that make them more open to disclosing anything that they might be going through in their lives, like personally. This individual himself, he had gotten into a fallout with his mother. There was arguing. He had gotten into something with his brother. So there was a lot of things that was taking place that he wasn't able to share with anyone. He was like, a lot of them are real guarded and resistant towards seeking any type of treatment. You know what I'm saying? Yet counseling. So the benefits of having outreach workers and individuals, as the cure violence models has, is that it's what I consider like portable case managers. You know what I mean? Like, these guys are constantly on the streets, canvassing the neighborhood. They from that area, so the high risk already have a strong connection with them. And they don't have to like wait for the following day till the program opens up. You know what I'm saying? Like, they could just see the outreach worker walking down the street and just approach him like, look, you know what I'm saying? Like, I just got into some beef with this dude. Like, I'm about to hurt him. And it's a great way to intervene on the front end. So it's very powerful. Yeah, 4 minutes. I'm gonna run through them. I only have a few more slides. So now these is the two major beefs that we have in our target area is between New Jack and Fever Block. The great thing out of this beef is that we ended up actually hiring one of the outreach workers from Fever Block, who's very influential and actually in both neighborhoods. He lives on Pelham houses, but he's known throughout the whole Bronx. So he has a high influence even in Bronx River, where he was assigned to work at. So because we are working to treat a community health problem, it is imperative that we engage the community as a whole. This is done on a daily basis, as I said, through canvassing the target areas, engaging with individuals who reside in the areas, as well as shooting responses that are conducted, which are organized by clergy leaders, elected officials, friends and family of the victims, and community residents to help mobilize the community to partake in anti-violence peaceful marches. So this is done 72 hours after a shooting incident. It doesn't have to necessarily be a shooting, it could be a stabbing, but we really focus on the shooting because that's our mission, is to try to prevent the gun violence and reduce gun violence in the community. So we've been up and running now at Jacobi Hospital for the past 2 years. In the past 2 years, we have seen a significant drop in gun violence throughout our entire target zone of 53%. 53, I'm sorry. So some may say, what's the benefits of having a program like this out of a hospital? And SUV is a unique model based out of the hospital because it creates an opportunity for us to bridge the gap immediately. We have what's considered a hospital responder, so anyone that gets shot in the northern section of the Bronx, and because Jacobi Medical Center is the #1 trauma center hospital in the Bronx, they go there. They take them there. So now we see them as soon as they get off, as soon as through the emergency room, there's someone by their bedside trying to figure out, trying to engage them, something that a social worker is unable to do. Because like I said, they're real guarded, thinking that, the social worker might tell the cops or give information. So what happens is the hospital responder, because he's already able to identify and relate, he is able to engage that person and, probe and try to get information that may help prevent a retaliation. So this is what the two components that is based out of the cure violence model from Jacobi Medical Center. We have the hospital component, which serves as with the social worker, a pediatric, the hospital responder. They see patients on a weekly basis after they discharge. Like I said, they focus. The hospital responder role really is try to prevent. Like I said, the person, the victim in this matter, to have try to decrease any thoughts of retaliating. So I think in the community component consists of a pastor, the outreach workers, the violence interrupter. As I stated, they have a caseload of 15 individuals, and they serve as mentors at the end of the day. They serve as mentors. They in the trenches. Like, they in the trenches. I mean, like, they're likely to being hurt or injured because of their role. But it's effective, and we do that by, like I said, trying to establish healthy reports. We take them out on field trips. Last year we took them to Six Flags. We took them to see the movie Barbershop, which, as you know, is a movie that was based out of Chicago gun violence. So we had discussions pre and post the movie, after watching the movie. So we strive on just having our visibility in the community, and just helping reduce the gun violence. And I think that's it. Thank you.